Right now, there is something sitting in your bathroom cabinet, maybe two or three things, that is quietly, slowly damaging the most important organ in your body, and you have no idea. I'm Dr. Kemi Lawson. I've spent 15 years in a community clinic in preventive medicine for people over 60, and here's what keeps me up at night. Nearly 9 out of 10 adults over 65 take at least one prescription medication every day. And some of the most common ones, the pain reliever you took this morning, the stomach pill you swallowed at breakfast, even that sleep aid you grabbed without a second thought, are doing things to your heart that nobody warned you about. Here's something research confirmed clearly, but that most appointments never have time to cover. These medications aren't failing because your doctor doesn't care. They're failing because a 7-minute office visit doesn't leave room for this conversation. So I'm going to have it with you right now. There are 5 medication categories that can silently weaken an older heart. And for each one, I'm going to hand you what I call a self-defense kit. 3 things: the safer alternative by name, the specific blood test or scan to request, and the exact sentence, word for word, to say at your next appointment. Tell me in the comments, how many medications are you currently taking, whether it's 2, 5, or 12. I read every single one. And number 1 is something millions of people take every day to protect their bones. It might be the most controversial thing I've ever said on this channel. Stay with me. Quick thing before we go on, put your state or country in the comments. I like knowing where people are when this finally clicks for them. And subscribe if you'd rather spot a problem like this early than learn about it in an ER number 5. And yeah, I'm starting with the one you'll swear is harmless. Non-steroidal anti-inflammatories, NSAIDs. You know them as Ibuprofen, Naproxen, Diclofenac. They work brilliantly for pain. Nobody's arguing that. But here's what almost never gets explained. Taking these regularly after 60, especially if you already have any heart concerns, is playing a very dangerous game with your cardiovascular system. The FDA strengthened its warning about heart attack and stroke risk on these medications back in 2005 and again in 2015. Yet millions of people still take them daily like they're harmless. So why does this happen? 2 things. First, NSAIDs force your body to hold on to salt and water. Think of your heart as a water pump. If suddenly there's twice the volume of fluid in those pipes, that pump has to work at full capacity just to keep up. A younger heart handles it. But a heart already dealing with stiffness from aging or fighting high blood pressure, it can fail. Second, and this catches people off guard, NSAIDs can tighten your blood vessels and push your blood pressure up. Even if you're on medication for that, these pills can cancel out its effect entirely. Your pressure climbs, you never feel it. Wild, right? A major international meta-analysis found NSAIDs can roughly double the risk of heart failure hospitalization. Diclofenac and high-dose ibuprofen, around 2,400 milligrams a day, carry the highest risk. Sylvia, 72, a retired seamstress, had been taking ibuprofen almost daily for knee arthritis for years. One afternoon, her ankles ballooned and she couldn't catch her breath crossing the living room. In the ER, we found acute heart failure. Her blood pressure meds had been quietly neutralized for months. She told me, "I trusted that little pill more than anything in my cabinet. No one warned me it could turn on my heart." Here's your first self-defense kit. Alternative, ask about topical diclofenac gel. It works locally on the joint, with far less reaching your bloodstream. Test, request an EGFR, a simple blood draw that shows how your kidneys are handling things. Scripted question, doctor, given my age and my blood pressure medication, is oral ibuprofen still safe for me, or should we switch to something topical? Now, here's the cruel irony. The medication many doctors prescribe to protect your stomach from NSAIDs might be creating a completely different problem through the back door. Quick question, and drop your answer in the comments. Type 1 if you've taken any medication for more than a year without anyone reviewing whether you still need it. Type 2 if a doctor has ever told you, just keep taking it. I'm asking because what comes next hits both of those situations hard. Because that, just keep taking it, that's exactly how number 4 slips through. Number 4, and this one has a bitter twist. Proton pump inhibitors, PPIs. Omeprazole, Pantoprazole, Lansoprazole. Chances are you know someone who takes one every morning. Maybe it's you. These are among the most prescribed medications in the world. Doctors hand them out for acid reflux, for stomach protection, often to shield you from the very NSAIDs we just talked about. Makes sense, right? Protect the stomach, but here's the key. The medication prescribed to protect you from one risk might be quietly creating another. Magnesium. Your body needs it desperately to keep your heart rhythm steady. Think of magnesium as the conductor of an orchestra. Take the conductor away and every instrument starts playing on its own schedule. That's your heart without enough magnesium. Irregular, unstable. PP is reduced stomach acid. That's their job. But that acidity is exactly what your body uses to absorb magnesium. Suppress the acid long enough, and magnesium absorption falls off a cliff. The FDA flagged this risk with a formal safety warning back in 2011. And yet, here we are. This is what a 7-minute visit doesn't catch. Nobody's cross-referencing your stomach pill with your heart rhythm. These drugs were designed for 4 to 8 weeks of use. 4 to 8 weeks. But millions of people take them for years, decades even. Marcus, 74, a retired postal carrier from Chattanooga, Tennessee. He'd been on Omeprazole for 6 years for chronic reflux. Never questioned it. His reflux was gone, so why would he? During a routine checkup, his ECG came back abnormal. Blood work showed his magnesium had dropped to a level his cardiologist called concerning. Marcus told me, I kept taking it because it worked. Nobody ever told me the price was showing up somewhere else. You might be thinking, but my doctor told me to take this for life. I hear that a lot. And honestly, that's the conversation worth revisiting. Here's your self-defense kit. Alternative. Ask about stepping down to an H2 blocker like famotidine. It's gentler on acid suppression. Also consider the basics. Elevate the head of your bed, stop eating 3 hours before sleep, smaller meals. Test. Ask for a serum magnesium level. Simple blood draw. Most doctors don't order it routinely for PPI users, but they should. Scripted question. I've been on Omeprazole for however many months or years. Can we try stepping down to famotidine or lifestyle changes first? All right. Before number 3, and this next one is going to make you check your own medicine cabinet tonight, quick pause. If any of this is connecting dots for you, take 1 second, hit subscribe, and share this with someone you care about. A parent, a friend, someone who takes a handful of pills every morning without thinking twice. That one click genuinely helps this reach the people who need to hear it. Number 3, and this is the one that gets misdiagnosed as aging itself, and this is the one that's going to make you ask, why has no doctor ever mentioned this to me? I'm talking about anticholinergic medications. Now, that word sounds technical, so let me tell you what you actually call them. Benadryl, Tylenol PM, Advil PM, that over-the-counter sleep aid you've been reaching for at bedtime for years. Actually, let me back up. I keep saying medications, but half of these are things you buy without a prescription. That's the scary part. You don't even think of them as drugs. These medications block something called acetylcholine, a chemical your brain uses to store and retrieve memories. Think of acetylcholine as your brain's filing clerk. Every time you remember a name, a face, where you put your keys, that clerk pulled the file for you. These drugs silence that clerk. And here's what makes this one different from everything else on this list. The damage is cumulative. Every dose adds up, every single one. A major 10-year study published in JAMA Internal Medicine followed over 3,400 adults aged 65 and older. People who took strong anticholinergics for 3 or more years had a 54% higher risk of developing dementia. Let that number sit for a second. 54%. And the American Geriatric Society now lists these on the Beers criteria, their formal list of medications considered potentially inappropriate for older adults. Yet you can walk into any pharmacy and buy them off the shelf. No warning, no conversation. Remember that question from the beginning, why didn't my doctor warn me? This is why. Nobody's adding up your total anticholinergic burden. Nobody is connecting the Benadryl you take for allergies to the sleep aid you take at night to the overactive bladder medication your urologist prescribed last year. That math doesn't happen in a 7-minute visit. Let me tell you about a family I worked with. Their mother, I'll call her Frances, 78, had been struggling with what everyone assumed was early dementia, forgetting conversations, getting confused mid-sentence. The family had already started touring assisted living. Then a geriatrician did something no one had thought to do. She reviewed every medication Frances was taking, including the over-the-counter ones. Turned out Francis was on Benadryl for allergies and a PM sleep aid at night. Two anticholinergics stacking up silently. After a guided switch, her clarity came back within weeks. Her son told me 3 weeks after they switched her, she was doing crosswords again. 3 weeks. Self-defense kit. Alternative, for sleep, try low-dose melatonin, 0.5 milligram to 1 milligram, 30 minutes before bed. For allergies, switch to a second-generation antihistamine like cetirizine or loratadine. They don't cross into the brain the same way. Test, and this is a good one. Ask your pharmacist to run an anticholinergic burden review. They can score every medication you take and flag which ones are stacking up. Scripted question. Can you check whether any of my current medications have anticholinergic effects? I want to know my total burden. Okay. Number 2. This one touches mental health and I want to handle it with care. I'm talking about tricyclic antidepressants. Names like amitriptyline, nortriptyline, imipramine, they were the go-to for decades. Today, they're no longer the first choice for depression. Newer options are safer, but they're still widely prescribed for something else. Nerve pain, diabetic neuropathy, post-shingles pain. That's where the trouble lives. Look, I'm not saying throw out a medication that's helping you with real pain. That would be reckless. But you deserve to know what it's doing to your heart at the same time. Tricyclics can cause a sudden drop in blood pressure when you stand up, what doctors call orthostatic hypotension. You get dizzy, lose your balance, you fall. And for someone over 70, a fall doesn't mean a bruise. It means a broken hip. Research shows tricyclics more than double that risk. But it goes further than falls. They also speed up your resting heart rate, constant stress on muscle that's already working hard at this age. And the part cardiologists worry about most? These drugs can interfere with your heart's electrical wiring, slowing down the signals that tell each chamber when to beat. On an ECG, it shows up clearly. It increases the risk of ventricular arrhythmias, the kind that can cause sudden cardiac death. You ready for what that looks like in a real person? Harold, 75, a retired electrician. His doctor prescribed low-dose amitriptyline for the burning pain in his feet from diabetes. It helped. He said it was the first relief he'd had in months, but he started getting lightheaded every time he stood up from his chair. One morning, he blacked out in his kitchen, broke his hip. In the hospital, they found his resting heart rate had been running high for weeks. He told me, "It quieted my feet and landed me in a hospital bed. I wouldn't sign up for that trade again." I want to be clear, never stop an antidepressant on your own. That can be genuinely dangerous. This is one you bring to your doctor, not one you handle alone. Self-defense kit. Alternative. For nerve pain, ask about duloxetine. It's an SNRI that helps both mood and pain with a much safer cardiac profile. Gabapentin is another option. For depression specifically, SSR is like sertraline or escitalopram are far gentler on the heart. Test, if you're on a tricyclic, request a baseline ECG and an orthostatic blood pressure check. They'll measure your pressure lying down versus standing. Scripted question, I'm on amitriptyline for nerve pain. Given my age, would duloxetine or gabapentin be a safer option for my heart? Number 1, and honestly, this is the one that's going to start arguments in the comments. I'm talking about calcium supplements, those pills that millions of people take every single day to protect their bones from osteoporosis. For decades, the message was simple: take calcium, strong bones, end of story. But what if that story left out the most important chapter? Calcium from food, dairy, sardines, leafy greens gets absorbed slowly. Your body knows what to do with it, routes it to your bones, your muscles, the places that need it. No issues. But calcium from a high-dose supplement, different animal. When you swallow that pill, it creates a sudden spike of calcium in your bloodstream. Your body can't use it all at once, and the excess has to go somewhere. Think of it like pouring water into a funnel. A slow, steady stream goes right through. Dump the whole glass at once and most of it spills over the sides. Except in your body, the spillover lands in your artery walls. That process, arterial calcification, makes your arteries rigid, less able to flex with every heartbeat, and it contributes to the plaques that cause heart attacks. One major meta-analysis found calcium supplements increased heart attack risk by roughly 30%. Now, the evidence is debated. Not every study agrees, But the concern is serious enough that it changed how I counsel my own patients. So what do you do if you're worried about your bones? Give up calcium entirely? No. And this is the part that almost nobody explains. Vitamin K2. You've probably never heard your doctor mention it. K2 activates a protein that pulls calcium out of your bloodstream and directs it into your bones, where you actually want it. Without K2, calcium supplements are sending freight trucks with no GPS. The cargo ends up wherever it lands. A 10-year study following over 4,800 people found that those with the highest vitamin K2 intake had a 57% lower risk of dying from heart disease and a 50% reduction in arterial calcification. That's not a small number. Oh, one more thing I should mention. The form of K2 matters. You want MK7? That's the form your body uses most efficiently. 100 to 200 micrograms a day. And it pairs with vitamin D3, which helps you absorb the calcium in the first place. So the combination is calcium from food first, aim for 1,000 to 1,200 milligrams a day through dairy, canned fish with bones, dark leafy greens. And if your doctor believes you genuinely need a supplement for diagnosed osteoporosis, then low-dose calcium plus D3 1 to 2,000 IUS plus K2 in the MK7 form together. That combination changes the math entirely. Delia, 71. Worried about osteoporosis, she started a high-dose calcium supplement on her own. No family history of heart problems, didn't smoke, cholesterol was fine. 3 years later, she had a heart attack. Her medical team ordered a coronary artery calcium score, and it was off the charts. She said to me, "I bought it off a shelf, no prescription, figured a supplement couldn't hurt. That was the mistake." Self-defense kit. Alternative, dietary calcium first, always. If a supplement is truly necessary, the D3 plus K2 combination I just described. Test. Ask for a coronary artery calcium score, a CAC scan. It's a simple, low-dose CT that shows exactly how much calcium has built up in your heart's arteries. It's the test I wish more doctors ordered. Scripted question. Before I start or continue a calcium supplement, can we check my coronary calcium score and make sure I'm also getting enough K2 and D3? So, 5 medications, 5 conversations you now have ready. Some of you literally asked in the comments on my last video why your doctor never told you this, and I want to answer that honestly. It's not because they don't care. Most doctors I know went into medicine for the same reason I did. But the system gives them 7 minutes per visit. And in those 7 minutes, no one is checking your anticholinergic burden. No one is measuring your magnesium. No one is asking whether you're still taking that calcium supplement your last doctor prescribed 8 years ago. That's why you have to be the one who asks. And now you know what to ask. You have 5 safer alternatives, 5 specific tests to request, 5 sentences written out ready to go for your next appointment. That's not me telling you what to do. That's me handing you the tools so you can walk in there and steer the conversation yourself. That bathroom cabinet I mentioned at the beginning, you now know what's in it, and you know what to say about it. Tonight, before you go to bed, I'd recommend doing one thing. Open that cabinet. Write down every single pill and supplement you see, including the over-the-counter ones, the PM sleep aids, the calcium, the ibuprofen. Bring that list to your next appointment and say, "Can we go through these together?" That one piece of paper might be the most important thing you bring. And if you want to know which specific tests every person over 60 should be requesting at their next checkup, I made a video on exactly that. I'll link it right here. So let me ask you one thing, and you can answer in a single word. Comment yes if a doctor ever warned you about even one of these 5 before today. Comment no if this is the first time anyone's laid it all out for you. I read every single one. And either way, your body's going to thank you for asking the questions.